All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to the second discussion for today. DDS is first, Jenna is second, James is third, Emily is first bean. Okay, cool. So welcome everyone. How was the discussion today? Did this make sense? Jim is here from Iowa. Jim, welcome. L is here. Hello. Cool. Roller Girl is here. Susan Pick. Laura, how are you doing? Eric is here. Ruby's a Red is here. Jim is here. sorry, L. Anna. And now we have a lot of folks. Barbara, welcome. Doug, Paul, Kumar, Trevor, Emily, Cher, Carolyn, Wayne. So Wayne starts with a question. All right, let's look at that. Wayne, the first shot of the wax is or is not the same as the second wax. The content are the same. The body's reaction is different. So body's reaction is different. Again, please realize that it is not necessary that every single second shot is going to cause allergic reaction. If that was the case, then vaccines could not have been given. But second shot can be a little more stronger in side effects compared to the first one. In some people, there's still about 60% of the people, nothing, even in the second shot. But in some people, still pain and some fever and myalgias. And thank you very much. Rosie has a super chat. Hello, first time here. Question about COVID vaccine and any evidence of affecting fertility. So no evidence of affecting fertility. I know that once I talked about this before as well, Rosie, and somebody said that I was being unethical to not acknowledge that this is what is happening. The reports so far, number one, in pregnancy, they are usually not giving the vaccine. Number two, there have been so many people, both in Pfizer's and Moderna's and other vaccines, where somebody got the first shot and before the second shot, they became pregnant. So there have been many, many reports of people becoming pregnant between the shots. So if there was any issue, of course, after the shots as well, both. So if there was any issue with the fertility, we would know, number one. Number two, from a mechanical point of view, it is impossible for the vaccine to cause an issue with fertility. Vaccine is creating spike protein in our body. Spike protein is like the hand of the virus. The whole virus cannot create infertility. Why would the hand of the virus create infertility? And then some folks say, well, the vaccine has some sort of nanobots in it, which are going to go and destroy a woman's epithelium of the uterus. That's not going to happen. Their epithelium recycles all the time. It is not going to cause any kind of damage to these areas. The virus doesn't do it. How can a tiny amount of the virus spike proteins would do it? So no, there is no such possibility. Even if we wanted to kind of say that, let's figure out a mechanism that somehow would cause testicular damage by the vaccine, or cause uterine damage or ovarian damage by vaccine, or somehow cause the hormonal systems to become upset by the vaccine. It's impossible to create such a mechanism. Melanie Goodman says, have you heard about the increase in shingles outbreak post-COVID vaccines? I know of 6 people how they have had a shingles outbreak within 7 days of getting one of the COVID vaccines. So that is, remember the transverse myelitis? So it is possible that vaccine will trigger the immune system, and then that can cause issues. Now, maybe shingles as well, although we did not see shingles in the vaccine's results, but these were, let's say, 30,000, 40,000 people. Now vaccine is being given in mass. So there can be things. The question is it then settling down or not? There is an interesting question from Roller Girl. What tips help you to study? So, Roller Girl, I have two basic ways I study, and it's not necessary that everyone does that. One, I am very auditory. So if I hear something, I can remember it. I still remember after 20 years, if I had heard someone in classroom, I still remember what the teacher said, what did they draw, and what was spoken. So that is just my auditory memory is good. Second is my visual memory. And the reason that I can make all these little doodles is that if I can visualize something, then it can stick with me. If I cannot visualize a concept, then it will not stick with me. So usually when I read something, my way of remembering it is to visualize it. And my best way to remember it to draw it. So people write, I draw. When I draw, it becomes sticky to me. I hope that is what you were asking, Roller Girl. A Simple Garden says, can the vaccine stimulate more issues for those with MCAS? Should they take Benadryl pre-vaccine? Sure, take Benadryl pre-vaccine. Take, what are these cells? Mast cell stabilizers if you can, but vaccine cannot trigger the mast cells in a way that the wild type infection can. Doug Gross says, melatonin maximum dose. So the right way to do this is, number one, you can consult FLCCC, but even they would say it this way, that take the over-the-counter dose. Then if it gives you nightmares or vivid dreams, then reduce the dose till the point where you don't have those dreams. Texas Meg says, wait a minute, vaccine causes pregnancy? Sure. Trevor, do you think more countries will start delaying the second dose? At least US is not doing it. I actually don't agree with the second dose, although now they have at least in the UK, they have created an airtight reasoning to say that actually if you give the second dose earlier, then the immune system somehow becomes overwhelmed and it does not develop enough. Actually, it goes down in developing its behavior against the virus. So if you allow it to go on for 3 months, then it actually booster dose behaves better. So that is just beyond belief, but that is what they have come back and said it, and I discussed that as well. So based on that data set, hey Luffy, based on that data set, countries would start delaying them. Rima says, can we look at total case counts in South Africa, please? Yeah, sure. So let's see. I still have the the cute thing up here. 1 second. Let me share my. Okay, so total case count. So let's say worldometer, and let's start with Israel and see how are they doing. Oh, look at this. This is daily new cases. Look at this day here. No new case here. So this is Feb. What is this date? Feb 19. Then this is Feb 21. So nothing on 20th. Although it is still trending downwards, but good. Look at this. I love this one. Look at the active cases. They at their peak they had 84,000 active cases, and now they have come down to 40,000 active cases. Very good. Daily deaths are reducing as well. So 19. At their peak they had 101. let's see if their 3-day average, their average has been 57, and so 23, 36, almost half. So that is Israel. If we say world, 112 million cases, and check this out, reducing. Daily deaths are reducing as well, although we were at a peak here. And okay, so let's look at US. Countries, US. And we'll look at South Africa in a second, please. Unfortunately, we have reached 500,000 deaths here, which was not, I could never imagine that would happen here in the US. Wow, look at this. Daily new cases, they continue to go down. 63,000 new cases at the peak, 284,000, almost 5 times reduction. Active cases still high, but trending downwards. Deaths, 1,675, 2,600, and then 4,000. So almost 50% less. So if we go to South Africa, do I not know how to spell South Africa? Oh, this is US. Countries. Loading. So sometimes when I'm sharing the screen, it just, I'll go out. So worldometer, South. Sorry. Let me do this. Let me go to Google, exit. Google, South Africa, COVID, worldometer, and I'll remove this. Worldometer here. So South Africa. Oh, wow. Look at that. Look at that. So if I look at the 3-day average, 1,000. So these are the daily new cases compared to 21,000 at their peak. So almost 20 times reduction. And if I say 7-day average, so their 7-day average at their peak was 18,000 and down to 15, 1,600. So 9, 10 times reduction. What a beautiful thing that is. If look at the active cases. So if this trend continues, I'm gonna claim that my hypothesis that if the spread is becoming more because the mutations are occurring, then the lethality is going to go down and herd immunity would generate now. So I'm going to claim that I was right. Look at this. 157, 758 at their peak, and 157. So almost 3-4 times less. These are beautiful results. How about UK? My apologies. I hope I'm not boring you. This page just keeps hanging up. Okay, so UK, United Kingdom. Where is UK? Here. Wow, look at this. Look at this. So 10,000, 9,000, still a lot of daily cases, man. 9,000, down from 60,000. So almost 5 times lesser. Active cases are going downwards. Look at this. We are going to be out of this pandemic very soon. And once we are out of pandemic, we are going to have parties in every country. So here, 313 average deaths, unfortunately, 1,500. So almost 5 times lesser number of deaths, which is excellent. Of course, some folks would say, why did you not look at India and Pakistan? So let's look at that as well. India. Wow, look at this. Daily new cases. Check this out. Look at this. Imagine this is 1.2, 1.3 billion people's country. 13,000 daily cases. At their peak, they had almost 100,000 daily cases. So about 8-9 times low. Active cases, look at that, how much lower. And look at the number of deaths, 100 per day versus 1,100-1,200. So 10 times lesser. Beautiful. Number one, they already have a great control. And then on top of it, they have very few. They have just very quickly dropping number of deaths. How about Pakistan? So what was their peak was here, 6,000 daily and 1,200 daily. So reducing, active cases are reducing, but kind of stable. That means they're not caring too much. Deaths are also not reducing as fast as we saw in other countries. 31 daily still and 141. Here in the second peak, 87 and 30. So almost 1/3. So this is what's happening in the world. We are going to be out of pandemic very soon. What will you do once you are out of pandemic? How do we test for MCAS? So very good question. In that paper that I was discussing from Dr. Afreen, they have talked about certain biomarkers which are for the mast cells. In addition to that, the important thing that they continue to say, they say that mast cells are known to have hundreds of mutations in them. Because of that, mast cell can produce so many varying kinds of effects. Because of that, there are neurological effects and the muscles effects and the blood vessel effect and the asthma and respiratory system and cardiac system and kidney system, GIT effects, even nasal fragrance effects. So, but there are biomarkers which can help with the MCAS. This is MCAS detection and diagnosis and treatment is very similar to treatment of the chronic diseases. Many folks who might think that they have Lyme, for example, they may actually have MCAS, or they may have some other chronic pathogen that is working with them. So, and now talking about that, Dr. Stephen Phillips will be with us on March 18. So if you have any questions, I'll tweet it as well so we can collect questions for him. If you have read his book and you have any questions from the book, we'll do a book club follow-up for him. Again, his book name is Chronic. I love that book. And I have no financial interest with him or no interest with him of any sort for his book or selling of his book or anything else. I think it's an important book. Everyone at the 10th grade and above should read it so that if they ever become victim to a chronic pathological disease like pathogen, bacteria, Lyme, those things, they can quickly understand that this is something that should be treated, can be treated, and then they follow up. Okay, so Paul Burke, if mast cells cause allergies and long hauling, is there something like allergy shots that can help? How do allergy shots reduce allergies? So that is the thing. Allergy shots, there are multiple type of solutions for allergies. Allergy shots are usually given for immediate allergic reactions in which we are trying to counter histamine and counter the other substances that are being released. There are allergic shots for long time as well. For example, if somebody is allergic to dust and that is causing severe damage to their tissues, then they might actually slowly give them small doses of that allergen to kind of make their system allergic to it, or make their immune system ignore that allergen. So in case of COVID, if let's say it is mast cell activation, then there are two now things to do. One is to counter the histamine that is being released, so that is by antihistamines. And second is to stabilize those cells. Imagine these are such a moody cells that anything you do, you move a little bit and they say, I'm upset, I'm going to degranulate. You go take a shower and they're upset and they're going to degranulate. You went into dust and they're upset and they're going to degranulate. So we want them to be stable. We want them not to behave that way. So there are stabilizers. For example, cromolyn, or for example, vitamin D, or quercetin, or vitamin C, or luteolin. These are stabilizers. So you counter the mast cell's behavior in two ways. One, you stabilize them. You say, good mast cell, do not do this anymore. We love you and all. And if they do granulate, then you give antihistamines. So in my opinion, both should be taken at this time by the long haulers to see if that helps. Lisa says doctors were too lost. Yes. B12, good question. Do mast cells beget more mast cells? It is a snowball effect. Actually, it's not really the mast cells causing that. Once the B cells have created more immunoglobulins, then that would trigger mast cells everywhere. It is possible that mast cell beget more, but mostly mast cell would just be part. Wherever they're sitting, if there is allergens, they would just respond. William Goff says, I'm scheduled to take my first Moderna shot in 1 week and honestly a nervous wreck. Is there anything I can take to prevent ITP or the rare spontaneous deaths that are being shown in the news? So without knowing the health status, without knowing the history, generally anti-inflammatories, antihistamines, these are the important things to keep in hand or keep using them. Vitamin C's, vitamin D's, vitamin K2, calcium, magnesium, copper, selenium, these things you should be regular on them, so that when you are going in, your immune system is not misbehaving, it is just behaving. Franz, thank you very much for 43 likes. Yes, mast cells are moody cells. They're very moody. People can just have a shower and they can get allergic reactions and hives. They're so moody. Meaning that is a mechanical issue. That just dropping of the water on the skin, just hitting of the water on the skin makes them mad and they degranulate. Thank you. Thank you. So Rima says, I wanted to Bangladesh. You wanted to see Bangladesh, Rima? Is that what you're saying? We can see that. I hope that is what you meant. Sorry if I am reacting in a mast cell way. Bangladesh. Here. Daily new cases. So beautifully going down. Let's see 3-day average. 364 new cases. At their peak, they had 3,775. So almost 10 times new cases. Is it 10 times? 300, yeah. That's a very good number. Look at the active cases going down beautifully, although slightly stable here, but I would expect them to continue to go down. Death rate similar like Pakistan, that not very fast going down, not like South Africa or India or I think UK was going down fast as well. So here, 11.6 compared to the peak at 49. So let's say 50 and then 10.6. So almost 10 times. So that's beautiful, actually. Almost gone. Almost gone. How is the question that is in my mind is, how is Bangladesh doing? Are they doing mask and social distancing, or have they come out and they've started just being normal? What is their vaccination status? Emily says, mast cells are the new insult. Yes, one can be a mast cell and one can be asked not to be a mast cell. Or one can be asked, why are you being a mast cell? Please don't hold back and tell us how you really feel about mast cells. I really feel bad about them. Somebody said that don't curse on YouTube because YouTube then does not let your video be seen by more people. So you can imagine that I could curse at mass. They're good as well, but most of the time they're just killing us. Samina says, welcome to Bangladesh. Thank you very much. I have, Samina, once I went to Ukraine there was a university there who invited me to come and talk there. And I went there, and one of the students there was from Bangladesh. He cooked fish for me. And it was such a tasty fish that he cooked that even now, sometimes I connect with him on WhatsApp and I talk with him and I say, hey, I still remember that fish. Gurav Shah says, hi, question. 20 days after COVID, I have been suffering from allergies, swelling, urticaria. It's been 7 months now. So are you saying that you had COVID about 7 months ago, 20 days after the COVID, you started having allergies and urticaria, and now for 7 months you are experiencing it, and you've been taking Allegra? Kindly advise what is the problem. So change your antihistamine. Change to, for example, famotidine, and start taking some stabilizers with it. Again, with your doctor's advice. I'm not your doctor. I cannot do this, what I'm doing. So I'm talking about over the counter. So maybe that is something I can talk about. But still, talk with your doctor, change your antihistamine, and then take some vitamin, some stabilizers. For example, here, as you saw from these doctors whose papers I read, that chromalin or vitamin D, vitamin C, lutein, chromalin. So see if these would help. Because the symptoms you are telling are all mast cell activation symptoms. Wayne says, I need to go to my wine cell. So one more thing, I spoke with Dr. Syed Haider this morning. Remember, he's the one who has been, I think there is a SayedHaider.com site. You can go there and he can give you a appointment and they can talk about ivermectin if needed, and he could prescribe it. So I spoke with him this morning and he said that I believe in ivermectin. He has said that hundreds and hundreds of patients he have treated now, and none of them became severe. Again, fingers crossed, touch wood, we don't want to jinx it, but he has great results from it. Denise says that he wrote my Ivermectin. Denise, you had asked me to say him hello, and I forgot while talking with him. My apologies. I'm going to talk with him tomorrow again, and I would say him hello. Al says, I lived in Florida for a while. It was the flattest place I've ever seen. Steve says, I have 2 with my patients. So Steve, have you seen good results with ivermectin? Mike is saying, hit the like button. 216 in the room and just 81 likes. Yes, guys, what's going on? Or should I become a mass cell and say, you don't like what I'm doing here? Let's see. Barbara Machiavelli. I think so. Isn't he banned? Who? Thank you. Correct. So, Wilbert, I haven't still looked at that. This whole week, my promise was that I would only focus on long haulers. And what I wanted to do was, I didn't want to just come in and say, hey, long haulers, we know that this happens and here are all the mechanisms. I wanted to come in and offer some advice to say there may be possibilities of doing following things to solve it. This is why you may have noticed yesterday's talk, right in the beginning, I said, here are the possible prescriptions, although I forgot quercetin and zinc. So please add that. And then today's talk as well, I first showed the stabilizers and antihistamines before I talked for the rest. So I want to get out of this week with a definitive possibility of what needs to be done for long haulers because of various mechanisms that may be contributing to their issue. So because of that, I'm not looking at anything else. It's like I've closed my eyes, the world is going by, and I am just working on long hauling. Odette says, do you agree with masking children in schools for 8 hours per day? Children, school. So I actually believe that schools should not be open at this time. So because of that, I feel that this is kind of, I don't know how to convince a child to say you need to wear a mask. I think they are more malleable than adults. So if we ask them, they'll do it. But in the first place, there should be less schooling, or schooling should be out in the open. And then maybe the rules should be that if you're sitting close and wear a mask, but if you're away from each other, you can take the mask off or be in the open areas. It's a difficult question because if anything happens to a child, that is a very heartbreaking thing. Heidi says, is there any truth to the idea that vaccine in general are not as effective for the immunocompromised? Then can we expect death rates to not decrease significantly because they're dying are mostly compromised? No. So number one, the dying are not mostly immunocompromised. There are many other comorbidities. For example, obesity is one. So death rate is going down and will continue to go down. That is one. Secondly, if somebody is totally immunosuppressed, meaning they just don't have the immune systems working, then of course vaccine is going to do nothing. But if somebody is immunocompromised, but they are still able to take care of infections and other, maybe slowly, then vaccine would trigger their immune system and will build up their defense. And honestly, if somebody is so immunocompromised that they cannot even generate some antibodies, then they would probably have to be in a very restrained environment, in a bubble-like environment. Eric Dog says, PCR versus antigen test can only be close to accurate. What would your test be if you had your way? So that is the interesting one. I would love to have the, did you mean PCR versus antibody test? Because PCR is the antigen test, right? I would love to have antibody test all the time, because that would tell me if my body has started responding or not. Doug says, melatonin, no nightmares with 12 milligram. I like to try a higher dose. Again, very simple. If you increase the dose, then go to the point where you have the nightmares and then reduce again from there. But just make sure that it can cause blood pressure variations. So don't just go too high. Simple Steve says, I have a friend. So please know that I'm not trying to ignore people's questions. What I do is, as the questions are running by, after responding to something, I look at the last few comments because I can catch the question there. So there may be some questions that have moved up. So my apologies for that. No bias. So Simple Steve says, I have a friend who is a long hauler. Symptoms are major fatigue and upper respiratory tract symptoms. What would he benefit from taking ivermectin? I can see him some 3 milligram tablets. How should he take it? So, okay, very important question, and especially in the context of ivermectin. For a long hauler, as you might have seen the rationale yesterday, the management approach is that number one, do they still have the virus in them? Let's assume for a second they have. Then ivermectin would help reduce the number of viruses and help. So that is one. Secondly, maybe they do not have the virus, but the immune system is going up and down or is dysregulated. If that is the case, then steroids would help. I would combine them both, because maybe we suppress the immune system plus we give ivermectin to kill the viruses if possible. Otherwise, when they would stop these therapies, the symptoms would appear again. Or the steroid have to be given for long enough that immune system is working suboptimally. And I shouldn't say suboptimally. It's not that it's not working correctly. It is working at a lower level, and it learns to ignore whatever is making it mad. The third possibility is something like MCAS, where we have other cells that are not working correctly. Let's say mast cell not working correctly. In that case, antihistamines or mast cell stabilizers will be needed. So what I would suggest, and I was talking with Dr. Heather this morning, and I was telling him that none of my patients have become long haulers. So I am at a loss that I do not know how to manage a long hauler because my patients didn't become long hauler. So he asked me and he said, what did you do? And I said, my way of working was that I would always give them near the end of their treatment, I would always give them steroid therapy. So I would always kind of, bounce their immune system. Lucky me, maybe it was just a hack. Maybe it was just I lucked out. Maybe there is some truth to that. But my thought was that immune system, to prevent it from going into long hauling, number one, I have to be aggressive right from the beginning. And number two, I have to kind of bounce their immune system. So he said that he would use that in his management as well. So back here to the question you're saying, I would recommend testing one by one. For example, testing first with ivermectin and seeing the results. If that gives results, that means there is inflammation. Of course, that is why the symptoms, and there may be virus somewhere. If that doesn't give the results and you try steroids and that helps, that means there is immune dysregulation. If, let's say, steroids, although steroids suppress the immune system, mast cells as well, but then we can just try the mast cell stabilizer or antihistamines and see what happens. And that would tell us if this is an MCAS issue. So I think it would have to be tested that way. I had seen a comment from sorry, the comment moved away. I had seen a comment from a cool bean asking for a cool bean name, but the comment has scrolled up. Okay. Klebe says, can't wait to receive my order of ivermectin, should be receiving soon. Very good. Carolyn says, question, if a patient is still having shortness of breath and extreme fatigue after a month, what blood work would you recommend to monitor and catch any diagnosis of MCAS? So the first thing is to get their chest x-rays, get their blood work to see ferritin levels, so that you are generally their hemoglobin, hematocrit. So the RBCs are there, bone marrow is working correctly, their iron is there, hemoglobin is correct. So just those normal things to look at oxygen level changes. Once you've done that, then for the MCAS, give me 1 day or so, and I'll come back with all the labs that they have recommended should be done. But generally for the MCAS, interleukin 4 and interleukin 6 levels are important for them to look at. Tumor necrosis factor levels are important as well to look at them. In addition to that, there are biomarkers for the the mast cells themselves, but that would be a difficult test to do on daily basis for person. That can be done in research. RB long hauler says, why don't they test GI or colon in long haulers to check for persistent virus? And even easier, they can check stools to see if there is persistent virus. Normally, virus can be present up to 59, 60 days after the infection. But if somebody is long hauler, they can check stools after that. So you are correct. It should be done. The question is, why don't I was talking with Dr. Syed Haider, and I was saying that I have talked with many doctors, and I've said that, hey, start using ivermectin, and they chuckle and they laugh. And sometimes when they say, what is your proof? If I send them the links, they don't read it. And if I send them my own videos, then they say, well, you're going to say it because it is your own video. So it is difficult to convince those who are not convinced. So Nancy says that I'm taking Fasenra shots for my asthma. Am I safe from AMCAS? Possibly. So it depends after taking the shot, what is your mast cells behavior? Are they totally cool down, or have we brought them back to normal? So that still is a question. But of course, you're modulating them, so that is good. France says, my feeling is that this virus has a cycle we don't understand yet, aside from human behavior. Maybe, and this may be just our immune system and viruses interaction that has a cycle. So Long Hauler says, follow up, does ivermectin make it into GIT? So there is a very simple answer, and this is a beautiful answer, actually, and beautiful question here. Remember, sometimes folks say that, hey, should I take it with food or without food? If you take ivermectin with food, then bioavailability increases. That means it gets absorbed more in the blood. If you take it without food, then it stays more in the GIT. So it really is that simple, that if you wanted some more quantity to pass through the GIT, then take it without food. So that means maybe without food, with food, 2 separate times. So the blood has a good level, plus GIT has that as well. Heidi says that, would obesity decrease vaccine effectivity? Not really. As long as the tissue is, meaning the injection has been injected in the muscle and not ended up in a fat tissue somewhere. Other than that, it should cause the proper behavior. Patricia says that, France, I agree with you. So France. Mackay Smith says, you said you'd look at World Economic Forum website and do a video about it. Did you look? No, I have not. Can you put the link here for which one should I look at? Teresa says, please, what is the fluoxetine dose and how long for long hauler? Teresa, I usually try to avoid the specific questions. What I would say is very simply, they had used 0.5 milligram of fluvoxamine. That was lesser, almost half of the regular dose. So I would just say that whatever is the therapeutic dose, lesser than that. Rima says, do we know what percentage of people are long haulers? So it seems to me, from the data that I've been studying, that about 30% of the people who become infected, regardless of the severity of the disease, they become long haulers. So I guess Cher is leaving. Cher Sabi says it's movie time. All right. This is a good movie as well. Fishtail says, but doctor prescribes ivermectin. So there is a doctor that we've been talking about, Dr. Syed Haider. He does it. If you go to my Twitter, You would see some folks have tweeted him to me and I've retweeted. Rima says, I'm sorry, so many questions. No worries. Sylvia says, what would be the best alternative for ivermectin? Not for this mechanism, because this is a specific mechanism that it offers. Yes, Rajesh had said. A suitable name, a cool bean name. Rajesh, what do you like? Al says, Colin says, how do I go to force the UK government to use ivermectin? UK government is just all over the place. Cher says, yes, you're a wonderful movie. Thank you, Cher. Yeah, so UK government is just... Rima says, why do you treat patients but not in the US? I have always been doing engineering and business here, so never got into the practice. I never got into practice as a regular practice to do business in general, meaning I never earned from my practice. From the very first day when I practiced, I have always either practiced for free or have given fees in charity. I've never charged, even till to date. I have never taken a single cent for managing someone. Mackay Smith, I'm not a moderator on this channel. Only moderators can add links in live streams. Dr. Bean, I think if you type in Google World Economic Forum website. Okay, so let's see. What should we be looking at? So, World Economic Forum. Is this the one? Cities are at the heart of our journeys to net zero. Here is why buildings are the foundations. Is this the one, Mackay? And what would we be, meaning it seems like 10-step plan to save our seas, how do diverse agenda, path for global vaccine race between nations can have no winners. Okay, I'll look into that. Mike is still helping. Yes, smash the like button and ring the bell. That's what I've learned from other YouTubers. No, I don't charge, Doug. My only source of income is through the teachings that I do and the website. That's it. And I don't do individual teaching. This is an exception that I come in every day. And this has been now about a year. But my teachings are all recorded, and then these are present on drbeen.com. And that is my bread and butter. Of course, during this time, there has been a lot of support from Cool Beans, the coffees and the GoFundMe and other donations. They have been great. But generally, from a business or earning point of view, I've never earned from managing patients. So to tell you something funny, when I started practicing in residency, there was a patient who was maybe 26, 27 years old woman. She was married, and she was brought to our ward, and she was paralyzed neck down. And they said she is not able to move for 3 days. And they brought in, and when I looked at her condition and I took history, I knew clearly it was a case of chronic tuberculosis and Pott's disease, and her spinal cord had been affected. So I said, who has been treating her, or have you been getting treatment? And they said, yeah, for years we've been going to this professor of medicine, and he's been treating her. And none of the medication was for TB. So I don't know what they were treating her for, but the mismanagement continued on to the point that she became paralyzed. And I became so sad. The shock that she could have been not paralyzed. It was so much that I asked those folks, I said, take her, bring her to my home, and I would try to, my hope was maybe I give anti-TB drugs and then there is still a chance that she becomes repaired. And so I brought her at home, and her whole family, everyone came home, and I started treating them there. And I was myself a resident, and my wife was like, what is going on? We have a patient at home. So that is how much I used to get involved. The very first time my patient passed away, when I was resident on my beds, I started crying in the ward. And I still remember the staff nurses, they dragged me out of the ward and they took me to the doctor's office. Then they called professor. They said, this doctor was crying when the patient has passed away. The patient's family would think that we have done something wrong. They're going to come and sue us and they'll be upset with us. Can you please tell him not to cry? But that is how much I used to get involved. So I guess you can see some of that even now as well, that this is just how I am. Okay, good. So let's do this. Let's stop for today. There's one more question and then we'll stop. Catherine says, what is the dose of bromhexine? I heard it's synergistic with ivermectin. It is synergistic with ivermectin, and just take the regular daily therapeutic dose. And you can just Google it. You can ask your doctor and just take the. Thank you. Cool. So this is the discussion for today. Thank you very much for hanging out with me. And let's continue our discussion tomorrow. I will go over this paper and talk about the neurological symptoms that they're thinking about and the other symptoms and the relationship to the mast cell, and once again, how to manage that. So thank you for today. Please like, subscribe, and share. And there are links in the description. One, if you want to become a patron, another to buy me coffees, and another if you just wanted to support the work that we are doing. Thank you very much, and I'll see you tomorrow.